Hello, welcome to the Surgical Assistant Podcast, a podcast crafted by surgical assistants for surgical assistants, where professionalism meets passion. Join us in fostering a strong, supportive community where unity among surgical assistants is celebrated and encouraged.
Okay, John, thank you. Welcome, everyone, to the Surgical Assistant Podcast. This is a podcast by surgical assistants for surgical assistants or anyone interested in knowing about surgical assistants. My name is Kelly, and I have been a surgical assistant now for just over 11 years. I have been in the clinical field for over 30 years, have worked in various scenarios. I've worked in doctor's offices some, and early in my career, I've been in the operating room for about 25 years, I think, if I'm adding that. And I was a scrub tech first for about 17 years. I went to First Assist School in 2012 and graduated in 2013. So I've been practicing ever since then full time as a first assistant. And I'm not currently in any specialty. I do a little bit of everything these days. John, what about you?
Oh, thanks, Kelly. Yes, I've been a surgical assistant since 2015 officially. I started in 1992 as a surgical tech, where I fell in love with the operating room long before that. Found out what the job roles were, found out what the next thing I could do to become at the surgical field, and which was become a surgical. And I did it for 25 years, and I loved it. But I pretty much got burnt out with the profession, and I was at a crossroad. I really, really always wanted to be a surgical assistant. I wanted to be right at the field, right hand man to the surgeon, helping him with the operation as opposed to just passing instruments, which is, basically one of the roles and functions of a surgical tech, which there's much more to it. So I took a break for a few years, for about 4 years, and I overseas. And when I came back, I decided I was going to be a surgical assistant. So I got into a program, became a surgical assistant. I got certified, licensed in Virginia, and now I work as a locums traveling around, which is how we met. I met Kelly when I was working at Virginia Beach General Medical Center. She was you were a traveler there, right? At the
Yep.
time? Yeah. And I was a permanent employee.
Right.
You know, the reason I came up with one of the reasons I wanted to come up with this podcast was there really wasn't anything out there for surgical assistants. Um, and I thought that we needed a podcast for us to foster community among us and to provide updates on legislation and as well as educational spotlights, new things. It's an evolving organic process, and it's gonna change as we go forward. But I'm excited to start it. Kelly, why did you kind of want to start a podcast? I know you had some reasons for starting one.
You called me out of the blue, and I don't know if you remember like how immediate my answer was. You just asked me, what do you think about starting a podcast? And I was immediately so excited because it has been in the recent past that I was doing a lot of driving. I was on the road a lot, and I enjoy listening to podcasts and audiobooks and that kind of thing while I'm driving. And I had actually looked for a podcast that was geared for first assistants and just looking for I'm always looking for any kind of augmentative knowledge or education I can get about our profession. And I could not find anything. I finally did come across a surgical technologist podcast. I cannot remember the name of it. And I said, this is cool. I'll listen to this because any kind of deep dive I can get in I imagine that they'd be talking about different cases and different instrumentation for specific cases and this kind of thing. And that's really what I was looking for, just some education. There's always something, no matter how long you do this, there's always something that you don't know, right? There's always something you don't know or you can know more of. So I turned that podcast on, and then it really did not end up being what I was looking for. So I just was deflated a little bit and thought, wow, there's nothing out there that I could find. And so luckily you've turned me on to a couple of podcasts that are geared towards surgical residents, which is great. I can cherry pick through those episodes and find great learning opportunities through those kind of podcasts. But as far as there not being anything for us. And so when you approached me about it, I said, yes, there's a huge need for a podcast about surgical first assisting and all of the things that come along with it. So here we are. So this is our first episode. We are recording, and we're excited about it.
Yeah, I'm very excited too, and it's a work in progress. It's going
Mhm.
to evolve, but I agree with you. I could not find a single podcast that was dedicated, towards surgical assisting. Like you said, I had found those other ones. It's more directed at surgical residents, and which is a great resource because,
Yes.
like you said, we can tease out a tremendous amount of information that's relevant to
Right.
us because we
Yes.
need to know that just as much as a surgical resident does.
Mhm.
But I thought about, well, what about somebody that's interested in surgery but doesn't know how to get there? Or what if somebody's just having a surgery to kind of know what to expect? I mean,
Right.
let's face it, TV does not adequately portray surgery in any way, shape, or form. If
I
you
don't
look
watch
at
it,
it, we can talk about that in a further
right.
episode. We can do an episode about surgery on television and the movies and going forward. But I thought we'd start out basically for every. I mean, this is going to be probably basic information for many of us, but for people who don't know anything about surgery, let's just define the surgical team. I
Mhm.
mean, when you come into the surgical operating room to have a procedure, you have people there for specifically trained for surgery. So you have the sterile surgical field, which consists of a surgeon that's doing your operation. Then you have his assistant, which is our role, the surgical first assistant. And that can be a surgical assistant, it can be a PA, a nurse practitioner. Then you have the surgical tech, which is specifically trained in surgery. They know all the equipment, they know all the procedures, they know the techniques, they know all the surgeon's preferences, they know how to work every piece of equipment, the name of every instrument. It's really all-encompassing profession. And that's the surgical field. Then outside of the surgical field, you have the unsterile people. You have the person that puts you to sleep, which is the anesthesiologist or a nurse anesthetist. And then you have the circulating nurse, with kind of the manager of the room and gives the surgical field things that they need at the time. Maybe it's medications, other equipment that they might need, because everything that we do and use in surgery is sterile. Plus, the circulating nurse, they perform the counts. And we'll go more in depth in future episodes about a typical operation is from A to Z. We can do that. Um, since this podcast is about surgical assistants, how do you become a surgical assistant? Well, there's 12 programs that you can apply to. In order to sit for a certifying exam, you have to graduate from a CAHEP accredited program, of which there are 12. And what does CAHEP mean? Well, CAHEP is the Commission on Accreditation for Allied Health Educational Programs. It's just a big word salad, but they're the governing organization that pretty much reviews and certifies allied health professional curriculum. And then after that, you graduate that program. The program is twofold. It's didactic initially, and then you have clinical phase. And then when you graduate the program, you have to sit for a certifying exam, of which there are three. And basically, they're just called the CSFA exam, the CSA exam, and the SA-C exam. We'll go into those in further detail in further episodes. But you have three different credentialing bodies, and they each issue a certification. For that, if you work in a state that has licensure, you have to apply for licensure. And there's several states that have licensure, more on the way, and we'll go more into that in future episodes. But after that, you obtain a job. And Kelly, you want to tell us some of the places where surgical assistants can work?
Yes, the first most obvious place is going to be for a hospital in a main operating room or in a open heart operating room. Um, so that's one. You could just go to work for a hospital facility. You could go to work for a surgical group and work just with a group of surgeons and be their first assistant. And your role and responsibilities are going to fluctuate depending on who you're employed by, right? So you can work for a facility, you can work for a private surgeon group, you can work on contract, you can work for yourself, which is great. A lot of people do that and have a good success at it. You can set your own schedule, work for yourself, contract with facilities, and go help out. Um, you can work for a surgery center. So, just an outpatient surgery center, you could do that. I have worked I could think my whole career, my entire career as a first assistant, I've worked for the hospital. I did have one job where I wasn't working for the main operating room. I just worked with one surgeon. I went to work, actually, it was straight out of FA school. I went to work with a vascular surgeon, and I was employed by the hospital, but so was he. And he just wanted his own personal first assistant to go to the operating room with him. So in that scenario, I worked in the office with him and then went to the operating room and the endovascular suite with him to work. Even that's a little bit different, right? That I was employed by the hospital, but I did not work for the operating room. Lots of different scenarios there as a first assistant. Is there any? Did I miss anything, John? Can you think of any other?
No, that's amazing. That's pretty encompassing. And yes, there are, like myself right now, I'm working as a traveler or a
Mhm.
locums. Hospitals have needs for whatever reason. Maybe they can't find somebody. It's a rural area, or somebody's going out on maternity leave or having surgery. So they contract with an agency to bring in somebody for typically 3 months at a time. And
Mhm.
then you move on to another hospital. Or if they still have a need, you can stay.
Mhm.
But uh, I thought that was a great thing you brought up about working specifically for a surgeon,
Mhm.
because there are so many different surgeons, so many different specialties, and surgical assistants usually work with them all. So if you're not getting the same surgical assistant each time, then surgeons want somebody that knows everything about them. They're very particular in certain
Mhm.
specialties. They want to know that you know exactly what they want and when they want it, how they want things done. So having the
Mhm.
same person consistently just provides better patient care.
Right.
And hospitals do try to provide that for surgeons. It's much better if you working privately for a surgeon or working just with one surgeon all the time.
Mhm.
And I like that you brought up the fact, surgical assistants can have independent practices, which many do. In certain states, it's more encouraged, or legislation is more set up for that. And we can definitely go into that in further episodes. But it's getting definitely difficult and harder to make a living as a independent surgical first assistant,
Mhm.
because the insurance companies, we won't go into any insurance company bashing right now, but they're always trying to find a way not to pay us, which
Of
is
course.
unfortunate
Right.
because we make the surgery safer and better for the patient. But it's one of those things. That would be a much longer podcast and a much more difficult, in-depth, discussion. The consensus and history of modern surgery.
In a nutshell, and I don't know that we just said it as simply as this. If we have someone listening, I love something I enjoy, John, is talking to young people, is talking to those high school seniors or those
Mhm.
students in college that want to go into the medical field. They might want to go into nursing or some aspect of the medical field, or maybe they know they want to work in an operating room, but what do they want to do? I love to talk to them and educate them about the different roles. I don't just talk to them about first assisting. I love to talk about the different roles in hospitals and what they do. And if that person is listening right now and is thinking, you still really haven't said exactly what a first assistant, the nuts and bolts of it is a first, the very where the rubber meets the road. The first assistant is the professional that takes the place of a second surgeon when a second surgeon is not available. So we are trained to, and I explain this to a lot of people that ask me what I do. And when I tell them what I do, they have a questioning look. When I just tell them my role, I'm a surgical first assistant, they have a questioning look on their face and they don't know what they've never heard of that. They've heard of a surgical nurse, and that's about what they've heard of. That you're a surgical nurse. But the first assistant is the one that we are trained to directly assist the surgeon to carry out that operation, right? We provide exposure for him. We are trained to control bleeding by the means that we learn, whether it's clamping and tying off vessels, whether it's cauterizing vessels. So we want to control bleeding during that surgery. Um, and in that, we're helping the patient and we're providing that exposure for him. He's got to be able to see where he's going and what he's doing in that surgery. So we're just there really hands on with the surgeon, just doing that surgery with him. Many times, most times, the when we complete the surgery, when the surgeon gets done with his part of the surgery, he's done what he's going to do. We're the ones that then close up, right? We close up the patient. We apply those dressings and bandages to the patient, and we're there with the patient from beginning to end. And it's really a privilege. I know you'll agree with me, John. It is a privilege what we
Mhm.
do, that we get to be there with patients when they are at their most vulnerable, and that we are able to really be a help to all kinds of surgeons in these surgeries. And it really, most surgical assistants, I would say by far, I would guess 99% of first assistants that I talk to personally love what they do. They love what they do. And
Oh,
it's
yeah.
really a very rewarding career that I'm very happy. I happily stumbled into it and found out about it not accidentally, I was looking for what I was going to do. My kids were going to graduate high school. I do have a background in nursing education. I was in nursing school at one point. I got more than halfway through that program, the nursing program, and life took over. I don't even need to go into all that. Life took over and it took a different direction, and I didn't complete that degree. But then when my youngest daughter was going to graduate high school, I thought, what do I want to do? I need to finish that nursing degree. And I really looked into it and really started lining that up. But by that time, just like you said, John, I figured out that I loved being in the operating room, that I loved helping that surgeon in the role of scrub tech. And I thought, what can I do that will keep me in this role? So I just started researching and found the role of surgical first assistant. And that's how I landed in it. And I have not regretted it 1 minute. It's been the best thing.
That's wonderful. I'm glad you brought that up because, like I say, surgical assistants are the best kept secret in the opera. Nobody really knows who we are or what we do, and it is a role. And you're right, I really didn't define it that much, but I thought you'd get a brilliant and succinct overview of what we do. And let's face it, people don't know about this profession unless they're exposed to it or they
Mhm.
know maybe somebody they have a brother, sister, cousin, uncle that's a surgical assistant or a surgical tech or a circulating nurse, and then they find out more from them. Because like you and many of us, like you mentioned, I love surgery. I mean, I fell in
Mhm.
love with it the first moment I saw it. I didn't know anything about it. I got a job as an orderly in an operating room, which I don't even think they have anymore, but it was a more combined role of housekeeper and patient assistant. Anyways, I went into my first operation, which is an open heart operation, and the doctor asked me if I wanted to come in and watch. So I did. After they got started, they invited me in. I stood at the head of the bed. They put a stool down. I looked down over the anesthesia screen into this patient's chest, and there was his beating heart. And I knew in that instant, this is what I'm going to do for the rest of my life. I looked up,
Yeah.
I looked around at the team. You have the entire team doing all of their roles, and they're there to support that patient.
Right.
And I just love the way you made that. I mean, we see people at on their worst day possible, but
Mhm.
also on their best day possible. I mean, when we do C-sections, it's the birth of a baby.
Right. Of course. Yeah.
But we are there to provide care for that patient. And I love everything about this profession. I love the history of it. I mean, I'm constantly reading about it and learning about it, and learning where we came from and where we're going to, because surgery is a constantly evolving thing, and I
Yeah.
love learning as much as I can. And that's the one thing you had mentioned it before. This is a profession where you never can know it all. You just can't.
Yeah.
And I don't think I ever want to get to the position where I know it all. Is we're constantly learning.
Right.
The best, I think the best surgical, as the best in any profession, but the best surgical assistants are those that remain humble and reachable and teachable. And
Mhm.
I could admit I've had moments in my career where I knew it all and nobody could tell me anything. And unfortunately, those are very humbling experiences when you
Well,
realize that it's not,
yeah, humbled, you are humbled, and that's what
yeah.
yeah, you run yeah, in our role, you're humbled. It's humbling,
Mhm.
it's thrilling, it's terrifying. It's you can go through all of these emotions in
It's
one
sad
surgery,
too.
and you've really gotta yeah, it's great. It's great. It keeps you on your toes. I say that to people all the time. Keeps me on my toes. I c
True.
and just like you'll hear young surgeons say or surgical young surgeons say that a gallbladder operation is never just a gallbladder. And by that, I
Mhm.
mean that we do a cholecystectomy, as it's called, is a removal of a gallbladder, is such a routine surgery, for example, that we tend to think of it, we're just doing. Sometimes it's easy to think it's just a gallbladder, but it's never just anything, is it? Because you don't know
No.
what's going to happen. You don't know what is going to present itself to you and that surgeon. And just you always have to be alert and aware and know your place. You have to know your place. Yeah. So
That's
you're
true.
right. The times I've been there too, the times that you really think, oh, yeah, I've got this. I've got this.
Mhm.
And so
Yep.
you're just going to be knocked down, but it's not good. It's not fun. So you're right. You have to remember to stay humble. But what a privilege. What a great career we found. And I know you and I
Mhm.
are about two peas in a pod when it comes to
Yes.
geeking out on things. We have our
Mhm.
textbooks. We talk about things, and I'm always trying to get little nuggets of knowledge. And I've had people make fun of me for walking around the OR with my little surgical recall paperback book. So if I have
Mhm.
downtime, I'm going to be in something reading about something because I want to know, no, 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 no. I want to know more and learn more. And I'm just not. I haven't reached any kind of pinnacle at all of knowledge
Mhm.
at all. Experience is a great teacher, of course. Um, It's just a really rewarding career. And I hope that if we had a group of people or even one person that listened to this podcast and entered this career and loved it as a result and found it as rewarding as we do, I would count that a huge success. So that we're able to even educate people to what it is, much less the future episodes that we have coming up that are really going to be geared toward our colleagues. And we have got so many topic ideas lined up and episode ideas lined up that it's going to be really exciting to talk about. We're going to be bringing people in. We're going to have forums that we can toss ideas back and forth with. And like our opening statement says, that we're really going to be fostering that community, that professional community, and respectfully talking to one another and drawing from each other's experience. And it's going to be really cool, John. I'm looking forward to it.
Me too, and I agree that fostering that community, because there are so many disparate groups that fall into the surgical role of surgical first assistant, whether they be nurse practitioners, RNFAs,
Yeah.
CRNFAs, SA. I mean, but this podcast is for everybody.
Yes.
And I was lucky enough, believe it or not, I grew up in a small town in Florida. Its only claim to fame was Burt Reynolds, pretty much, but he was an awesome guy. But we actually had a class in it was called Health Occupations, excuse me.
Oh, wow.
Mrs. Stefan, yeah, she ran that, but she had retired as a scrub nurse, and
Oh,
her class was strictly exposing people to health occupations, what you
uh-huh.
can do, and it ran the gamut, but it was very heavily focused on surgery because that's what she knew. She
Yeah.
told us about the surgical operations she did and what it was like in surgery, and she showed us video. Well, back then it was movies with
Yeah.
projectors of the history of surgery, and I fell in love with it, and that's how I found out about the different roles, different surgical roles. But unless you're exposed to it, you don't know. So
That's
I
right.
think I like your idea of doing outreach and bringing that to young kids in high school,
Yeah.
because they don't know about it, and some people are lost after high school. They don't know what to do, and if
Right.
you're lucky enough, like I've been, to get exposed to something that really excites you, and this can be a tiring profession, but I'm never that. I knew
Yeah.
surgery always gets me excited, and I'm always learning
Mhm.
more, and that's what's great about this profession is we're
Yeah.
always learning more, and we get better as we get older. The more experience we get, the better we get, and then
Mhm.
it's incumbent upon us to pass it along to the newcomers, people that are just becoming surgical assistants,
Right.
becoming surgical techs
Right.
that have an interest in being surgical assistants. I think that's
Absolutely.
wonderful. But I
Yeah.
definitely would love to foster that one cohesive community, because at the end of the day, let's face it, there's a lot of infighting in many groups, but I don't think we need to be fighting amongst ourselves. I mean,
No.
we're all here for the surgical patient. People come into the operating room and they're scared when they have surgery. Somebody who's never had surgery before, they don't know what to expect. We're there to usher them through that process. I mean,
Mhm.
I
Yeah,
personally
well,
consider this a sacred profession. To participate in somebody's healing, I think, is one of the most
absolutely.
sacred professions you can do. And we will not foster any infighting, or we won't
No, no,
bag on
no,
any one
no.
certification over another, one profession over another,
No, we're gonna
because at
encourage
the
each
end of the
other and
day,
we're gonna learn together
exactly.
and we're gonna draw on resources. Look, you and I both know that there are people that are know more than we do, and we know them,
Exactly.
and we're gonna have them on the show
Yes.
at times, and they're going to
Yeah.
be
Exactly.
feeding into us and teaching us what they know. And you're like very knowledgeable in some areas of surgery that I'm not. You're going to be helping me. I can help you with things. So this is really the kind of community that we need to have in this profession for sure. So I'm just looking forward
Exactly.
to it. I'm looking forward to
Mhm,
it.
and passing along resources to others of where to find things, or
Absolutely.
how to find more education, or what
Mhm.
conferences to go to. This
Mhm.
year I went to the
Oh,
Maddox
we're going to
Trauma
get into,
Conference in
yeah,
Las Vegas for the first time,
we're
and it
going to get
was
into all that.
eye-opening.
Yeah, we're
It
going
was
to get into all
eye-opening.
that. Yeah.
So we need to pass that along, to
Yeah.
people, and show them where they go, and just expose them to what else is out there, because sometimes if you don't know until somebody shows you.
That's right.
So you can take advantage of it, or I mean, it's just
Yeah.
a surgical salad bar. Take what you want, leave the
Yeah,
rest.
yeah. So if you've listened this far, if you've joined us and you've listened this far, we're wrapping it up, but I can promise you that we have so much goodness coming your way with these future episodes. We've just got a
Yep.
jam-packed schedule, all kind of things to talk about and help you and help us along the way. We're going to be enriched along the way as we do this with you, but we want to give this information to you and just all kinds of good things. I can't even go into it, John, but we've got them lined up. There should be a couple more episodes up right now. If they found this
Mhm.
one, John, we're going to have at least
Exactly.
3 or 4 to choose from. So hopefully you'll listen to us again, and we're going to get better from here, John, because we are novices at this, but it's
Oh,
going to.
definitely. It's evolving. But
Oh,
kinda
yeah.
do you want kind of throw out some teaser them, like what to expect, what kind of future
Well,
episodes
I
to
mean,
expect? Just in generality?
just coming up immediately, we are going to talk about that comprehensive operating room team. We're going to go into all those roles and what they specifically do. Again, if you're that person that's looking for that career, we're going to hit on all the nitty gritty about all those roles that John mentioned earlier. Really nitty gritty. We're diving deep into all those roles. Then we're also going to be talking
Mhm.
about specifically the avenues to become a first assistant, the educational pathways, the schools that are available, the programs that are available, the different career pathways that you can come up through. We're going to take a deep dive into that. That's going to be a great episode, knowledgeable. But just going down the line, we're going to talk about the trauma OR. We are going to talk about different devices, guys. We're going to talk about for first assistants that you've been doing it a while and you want those educational highlight sessions that we're going to do. We're going to be talking about stapling technologies. We're going to be talking about Da Vinci 101, all things Mr. Roboto. And we are going to be talking about things like mesh. We're going to be deep
Mhm.
diving into specialties and different. What do you need to know about doing a C-section? Maybe your
Mhm.
first assistant's been there a while. You haven't done a lot of C-sections. We're going to take a deep dive there. That's just a tiny sampling of all the things that we have lined up.
That's great. Yeah, I think there's so many we can come up with. I'd like to do one on the history of surgical assisting.
I
I'd like to do
love
one on traveling, all
Yeah.
things how
Let's
to
go
find a
ahead.
good recruiter, what things to
Yeah.
look out for. I mean, there's
Exactly.
tons of
Much,
it. I
y'all,
think
so
it's
much. And we have them lined
endless.
up. I've got my
Right.
list, and
And we're open to suggestions too. If there's something you'd like to
absolutely.
hear, or if there's something you'd like to
Oh, God, yeah.
reach out to, leave it in the comments, or
Definitely.
the email address that you can get
Mhm.
in touch with us with that we'll give you in the future.
Do the
And
homework and bring
we'll
it
have
to them, present
guests.
it. Yeah.
We'll have guests. I think there's a lot of good ideas we have. So
Mhm.
if there's plus if there's, like I said, if there's anything you want to hear about or a topic you'd like to know,
Yeah,
leave that
please
in
let
the
us know.
comments or shoot us
Great.
an email and
Mhm.
we'll work on it. But yeah, I think there's a lot of great things to come and I'm really looking forward to it. I'm super excited.
Yeah.
But we're going to try and bring them to you on a regular, consistent basis. Life interferes with that. We both have jobs and they're demanding jobs. We're going to do our best to keep them
Yeah.
coming on a regular basis. So
Yeah. Yeah.
that's going to be
We're
great.
both motivated to do this. So again, we appreciate you joining us today.
We do.
And yeah.
Thank you very much. Don't forget to like, comment, and subscribe. Right? That's what everybody says, right? At the end of their podcasts or videos, don't forget to like, comment,
Do
and
all the
subscribe.
things. Do all the things.
Exactly.
All
Thanks
right,
for
guys.
joining us.
See you
We
next
really
time.
appreciate
Yeah.
it. Yep. See you
Bye-bye.
next time. Thank you for joining us today. We invite you to like, comment, and subscribe to our podcast. Feel free to look us up on Facebook at The Surgical Assistant Podcast. If you like, you can also email us at thesurgicalassistantpodcast@gmail.com. We look forward to seeing you on the next episode. Content of this podcast is created for surgical assistants and is educational only. It is not intended to diagnose, treat, or offer medical advice on surgical conditions. No patient-specific information is shared, and all HIPAA guidelines will be adhered to.